Hello, I'm Dr. Mike with the Besso Clinic, and I'm here with Mr. John Lanchey. He's a patient. He's had some good results, and we just want to get his story. So Mr. Lanchey came to us last April, and he was in a lot of pain. We actually met him at a community fair, and he was pretty crooked at the fair, and he agreed to come in and let us check him out, and we found some issues. So, John, why don't you tell us a little bit about what was going on back then and how things have progressed since then?
Well, about 2.5 years ago, I had a back operation for spinal stenosis, and they fixed that in my left leg. But at the same time, they put in 2 bars and 4 screws between 4 and 5 in my back. Unfortunately, that left me with a limp and constant pain. It was pretty tough. I couldn't get in and out of bed very well. If I got up in the morning, I used 2 canes. It was kind of so bad that to get my mail, I would back out of my garage and drive out to the mailbox to get the mail. So obviously my life wasn't really too good at that time. I went to another physician, nameless, and of course he really wanted to take out one of the bars in my back, put a longer one in, and admittedly at my age, I'm 84, he wasn't sure whether that would work or not. So I decided to try some less invasive procedures, which included some pain management and chiropractor. Actually, I was on like 5 pain pills a day, and actually 10 because I took 2 at the same time. What happens then, of course, is because you're in such pain, you really can't exercise or move, and as a result, my muscular situation deteriorated also. So when I came in here, I was in pretty bad shape, and not frankly expecting a whole lot. So at any rate, been going here. And the amazing thing is that the pain is virtually gone. I have a little bit when I move. I'm down to like maybe 1 pain pill a day if I do that. And that's like in the morning, because not only do I have a curvature of the spine, I also have arthritis. So I was a little bit of a challenge, I think, for the doc here. But at any rate, the non-invasive procedure and the manipulation with the tools really helped. And if anybody's been in a lot of pain, to be pain-free is like, it's worth everything. Since that time now, obviously I walk to get my mail. And I've taken a trip to Washington, D.C. on a tour, which walked like crazy amount of time. I do use a cane, and I'm a little slow, but I made it. I also went to Nashville and got all over. So now I'm able to travel. I mean, it's just unbelievable, really. So I know I still have a little way to go, and now I'm going to therapy since I can move with some minor exercises to help strengthen the muscles. And as a result, I'm progressing. So the big thing is the relief of the pain was really incredible. And what can I say? That's my story, pretty much.
Awesome. Yeah, interestingly, on John's first visit here, he got stuck at the front counter because he had a back spasm. He was in so much pain. He was there for a few minutes before he could even leave.
Yeah.
And then now he's walking in and out and doing pretty good. So, well, John, thanks for your story. That's encouraging, and glad we're helping people here just like him at the Besso Clinic. If you have a similar situation, surgery, fusions, we can work around that, and we have very accurate procedures, very objective. We use instruments to adjust, and we can still help people even with fusions and rods and issues like that. All right, well, glad you're doing better, John, and we'll see you at your next visit.
Appreciate the help.
All right,
Try it out if you haven't tried it.